let's go ahead and we'll say, obviously your name, if they don't know you, because there are some younger students on here as well. When you went to school, where your undergrad was. I think that's always a really nice thing to talk about. Where you're currently practicing, and maybe a fun fact, or why you decided to go to Aspen Dental. How about that? Sound good? Who wants to start? Dr. Soto, the veteran.
Okay,
Go ahead,
fine.
we'll get Dr. Soto to start off.
Fine. Hi, I'm Dr. Soto, Gabby Soto. I graduated in 2019 from Western, of course. Undergrad, I went to Barry University in Miami. I'm currently working in Fort Myers, Florida. I was lead dentist in South Naples. Now I'm finally transferred back to my home office. So less driving, so it's nice. I decided to join Aspen thanks to Despina, actually. Despina told me about Aspen, and they're located all over Florida, and I was like, this is perfect. So yeah, it was nice to join with my bestie in dental school. So yeah,
there you go.
Worked out.
All right, next we'll go Dr. Despina.
Yes. So on that note, my name is Dr. Despina. I also graduated from Western in 2019. I went to UC Riverside for my undergrad. I currently work at office number 2382 in Lubbock, Texas. And I love it. I've been managing clinical director or lead dentist there for the last year and a half. And it's just fantastic. I found Aspen Dental kind of by chance because I was moving to Lubbock already and I was looking for jobs and I was like, oh, look, they're hiring. And it's honestly been like the best decision I've ever made.
We're glad to hear that. Dr. Mehta.
Well, my name is Dr. Pooja Mehta. I am a recent 2020 grad. I went to undergrad in Austin, Texas, and I will be practicing in Clovis, California when I'm done with my residency program. And I am very, very excited to be joining Aspen. And I have to give all my regards to keeping in touch with Derek. He helped me through this whole entire process and was able to hook it up for me. So I'm very, very excited to start my job in August.
That's awesome to hear. Well, welcome to the family.
Thank you.
A real quick intro. For anybody that hasn't met me, I'm Derek Robinson. I've been with Aspen Dental Management, which is technically a different company as a part of, in compared to Aspen Dental, the offices. Been with the company for 3 years. I'm in charge. We do our breakdown of schools based on ASDA, so I'm ASDA District 11. First off, I want to give props to Adia for helping put this together. I hope everybody had a fun time. And also, I want to start off with this loaded question because, again, I do work for a different company than all of our doctors. It's called Aspen Dental Management Incorporated, or ADMI. So we are two different companies, and my main responsibility is to assist on the business support side for our doctors. So my first question to our docs is, how do you feel supported by the business side? Let's go Dr. Soto again. Number one.
So supported, basically they knew, so let me just kind of give like a backstory. One of the regional managers, I've been going back and forth with her constantly because I got placed during COVID time in an office that was about an hour and a half from where I was. And they needed an emergency, basically somebody to cover because the other doctor, she had to be, well, I don't know. Basically, she ended up not working anymore. So I ended up staying there for a whole year. And I was like, okay, this is an hour and a half of driving every day there and then an hour and a half back. So finally, my regional manager, she ended up taking the position and she was like, okay, you know what? Like, we have to get her out of there because like, she's tired of it. And she got me back into Fort Myers, which was nice because this is my hometown. And now I'm literally driving like a 10-minute drive to work. So it's perfect. So awesome. I feel really supported by them. Not only from the business aspect, but they do take into account your health, so especially driving, driving and managing like 60 patients a day or something like that. And a big, like high income office, it takes a toll on you. So yeah, so I felt really, really like protected, I guess, by them, you know?
So that's more on the, you know, the feeling of the feeling of being supported. What about Dr. Destina? What about like the analytical side, or the side that is more on the numbers?
Okay, so in terms of numbers, I definitely feel really supported. My regional manager, I would have to say first and foremost, like Aspen and ADMI, like they really value their doctors, and they're really trying to make sure that you're in the best place for you. And they always want to make sure that you're growing. So obviously I didn't start off as a managing clinical director. I grew into that position, and I would have to say that in terms of the numbers, they're always there to support you and to really push you to do your best. There are no real quotas, I would say, or things that we have to meet, but they do analyze like the data, and they kind of tell you like, hey, you know, like we feel like this is what's happening, or great job, you're doing a lot of Invisalign, or whatever it may be. They're always there to I guess be like your rock, I would say.
Yeah.
I think that everyone needs to have a support system, and that's who you reach out to, like when you're in trouble, or like when you need help, or just when you're looking for some encouragement. My team is fantastic here. In terms of numbers, really, there's nothing you can't do with Aspen's support. I didn't think that I would be like where I am now when I graduated back in 2019. And so I think that they do a really great job of figuring out like where to place practices so that you're like the doctors are successful.
So on that note, is there any corporate instruction? Like, are we telling you what procedures to do? Obviously,
No.
I can't, you can't
No,
talk about that.
definitely
Great.
not. There's obviously like cool new gadgets that like ADMI like wants us to buy. Like they were like, hey guys, we invested in iTero. It would be cool if you started scanning patients for stuff. But really, no, they don't like dictate treatment like in any way, shape, or form. I have like total autonomy, and I believe that like all doctors really do in terms of like what they're comfortable performing procedure wise, which is what's so great about Aspen. They are like, as a company, always trying to promote like new great things, but it's for our benefit and not really because they're trying to increase their numbers.
And I think everybody here today, just to give you an idea, is the support side is here to allow you to focus on what you went to school for, right? Which is focusing on the patient and making the patient feel as comfortable as possible. In fact, it's actually a part of the entire analytical side of patient experience. And if they have a great experience, you'll actually be incentivized for that too as well. So you know, that's something that we can definitely talk about. I want to get to questions. First question. Thank you so much, doctors. Can you tell us, what procedures do new dentists do? Who wants to start that?
All of them, everything.
All of them.
Yeah.
Whatever you
Get thrown in there. Yeah.
whatever
So
you
what
feel.
about if you don't feel comfortable doing one?
So that really has to do with your POP. Sorry, I didn't mean to like jump in, but that really has to do with your POP. So Aspen is like owned by like other dentists, and then some of them are owned by like larger groups. And so if you're working with an office that has a POP or an owner dentist, typically that's who you would like turn to, and you would say, hey, like I want some additional training, or I just feel comfortable starting off with these procedures right now, and then I want to move forward to the rest of them once I feel a little bit more comfortable. Typically, they're going to work with you because they want you to succeed. That's also why there are like associate positions, so that you have that flexibility. There's going to be like a managing clinical director there to support you in case there's something that you don't feel comfortable doing. You can always like refer out to. So there's like a variety of options there that are available to you so that you can feel comfortable.
Awesome. Dr. Soto?
No, that's exactly what I was gonna say. Yeah.
All right,
Yeah.
perfect. Hey, when you're on a time crunch, I love those. You know, I like it. All right, we're gonna get everybody involved. What was your most memorable experience at Western? Let's start with Dr. Mehta this
Oh my
time.
God, you're putting me on the spot.
Yeah. You know, just think about like from everything that you did, was it getting involved, getting involved in ASDA? Was it getting, was it clinic? What sort of thing pops out? Was it even just hanging out with your classmates?
I think it was like a combination of anything. So I am a group 2 survivor / graduate. So if anyone who understands what group 2 is like, I'm sure y'all understand that. But being in group 2 and then getting really involved with ASDA and actually being, I think, lunch and learn coordinators with one of my best friends, Miss Dr. Solomon. So I think that was probably one of my best memories. Which sounds
Awesome.
weird in retrospect, but it was pretty fun.
You're making a plug to get involved, is what you're saying.
Yeah, absolutely.
Good to know. Dr. Despina.
Okay, so obviously most memorable experience was that I met some of my best friends there, and now we even work for the same company, which is awesome. But also like in terms of just clinical difficulty and things like that, I like had an implant fail and fall out like in the middle of a procedure. And I think that like Western U really prepared me for the shit that happens like in real practice. And sometimes it gets crazy, but you have to like keep your head straight and just keep going.
There you go. Nice support from the professors, right?
Yes, definitely.
Dr. Soto.
Yeah, basically what Despina said. Exactly. No, I'm kidding. No,
Come on.
in all honesty, I felt really prepared in Western. I felt like I did a lot of procedures that not many other students do in other other countries, other dental schools, sorry. But basically, yeah, I felt really prepared going into as an associate and then basically becoming a lead right off the bat. And yeah, it felt really, I felt okay, like I wasn't gonna be like completely like killing somebody or something like that, so it's okay, we're good.
So, for D1 to D4, the one thing that I would say is, you going to school isn't going to prepare you for the workforce, but what it'll do, it won't prepare you from the way to communicate with the patients or the surprise situations that come up. But what it'll prepare you for is the level of knowledge and your willingness to learn and understand, and that will carry you throughout the entire time. I think a lot of people feel this level of like insecurity of starting day one straight out of school. And it might be due to many different factors, especially during these tough times. But what I can tell you is that if you're motivated to learn and you're willing to work, you'll definitely see a lot of the support. And with that said, I do have a question here. What perks are available for the doctors straight out of school? And which ones do you use the most? So I will let Dr. Mehta take this one, maybe from what they've told you, since you're not officially starting. Are there certain things that really got you interested in the idea of working for the company?
So one, I will say they had options available in my top state that I really, really wanted to go back to. But besides that, just having like the environment and the support and meeting the doctors and the owner doc that I'd be working for, and just understanding that collaboration is there, and everything that Dr. Despina and Dr. Soto is saying is very, very true. They're not there to dictate you on certain procedures. Like being in a residency program, I've realized that there are certain procedures that I love doing, mostly like oral surgery, if I'm being blatantly honest, and some other stuff that I'm like, okay, like I don't mind doing, but not like my most favorite or go-to things. And they don't worry about that. Like the owner doc that I spoke to, he was just like, you can do whatever you want to do and we'll just take it from there. So
just to piggyback on that, this is your license. So you're going to do what's best for that patient. And on top of that, it's a collaboration, right? You're not working as an individual with this company. You're working as a team, not only from doctor to doctor, but, doctor to the front desk individuals, the dental assistants, the hygienists. We even have lab technicians in there and specialists that come through. So you're working collaboratively with all these individuals instead of having a percentage of collection or production or individual goals. You're working all together to obtain this type of goal. So Dr. Soto, what do you have to add to that as far as like the perks go? Or like, what did you use or what did you feel like was helpful for you straight out of school?
So, the free CEs, which are nice. Okay. But no, in all honesty, being in a team, being able to communicate with different doctors from the same PC, know that you can always like refer out, and you won't get judged. Basically knowing your limits and they know your limits as well. So, I really like that. And they respect it, so that's one of the main goals I wanted over there, with this company. The other thing is that in other companies, I felt like they were pushing you, right off the bat. They were basing it off of production constantly. So you were kind of pushed to do a certain percentage to kind of like to make up for that daily rate. With this, you get a nice little bonus at the end. So it's nice, so you get daily rate on top of that with the bonus rate. So it's good. It's good.
Awesome. Dr. Despina.
Sorry, I don't really feel like there's a lot to add to that. They did a really good job. There's like a lot of leadership opportunities like available. They do a lot of training. They're just really there to make sure that you grow. And I mean, that's all there is to it.
Awesome. For the 219 docs, how many people work inside the average office approximately, if you kind of number them out? Like how big is your support system in there?
So, do you want to go first, Gabby?
I'll put my hand up if you want to count them out loud.
So right now I work with an average with DAs, lab techs, and PSR, well, people in the front, and office manager and doctors. I work with an average of, I think, of 18. I know that sounds kind of weird. I know, but we have double lab techs now, and we have one that she's actually training there. So it's an office. It's like a clinic basically. Yeah. So we do have around like 5 people running in the front because it's a high influx. Like today I saw like 26 new patients by myself and I was like, oh, okay. So yeah, it was fun though. Yeah. But definitely if you have the team, you're able to do all that, So, and you're able to do production, meaning like, the procedures and everything. As long as you have a good like background, meaning a good team. Okay. If you have like, I worked in another office and the one that I was the lead, and I only had around like 5 people, and from going from an 18 office to a 5-person office, I'm like, I was bored. So I like the whole influx of patients and being able to see a different variety, being able to work with another doctor as well. Not because like, we kind of like, switch back and forth. So sometimes I see the new patient, sometimes he does. So it's like, we work really well together. So yeah, I mean, that's the average for us, but that, I guess ours is more unique, I guess.
What about you, Dr. Despina?
Yeah, so I think I have more of like a traditional style office in the sense that it's a single doc office with 1 hygienist, 1 lab technician, 4 DAs, and 3 people in the front. So that's like a total of 10 people. And sometimes we have trainees for different things, but that's going to be like my core group for my staff. And I think that runs really, really smoothly. Really, I feel like it is more reminiscent of a private practice, I would say. I'm just with like a higher volume.
I mean, between 5 and 18, it sounds like there's no cookie cutter specific type of office. So on that, I did have a question in the chat. What do you mean by owner doc? So you can be an owner while working for Aspen? Heck yes, you can.
Yeah.
Opportunities are going to be available. And you're actually, not only can you own 1 office, you can technically own up to 5 practices. And some of who we call our OG doctors, the ones that have been around for 20 years, some of them own up to 25 offices or making like $4.5 million a year. So at that particular point, obviously you only have 2 hands and you can't be in all 25 offices. So they become a little bit more on the business support side, helping out and inspiring all the different offices and making sure that everything is looking good from the numbers side and also from the strategy side. So with that said, let's move on to the next one. What are the hours? And Dr. Mehta, you can also be included if you happen to know what your hours are yet. Who wants to start it?
So I work 40 hours a week. I have 4 long days and Friday is my half day. So that means that I work from 7 to 5 Tuesday through Thursday. And because of us wanting to accommodate more patients, I do have a late day where I stay open a little bit later, but we also start later. So Aspen's, I think, like biggest motto is just like access to care. And so we want to see a lot of patients, but we also want to accommodate their schedules. So I open a little bit earlier than most dental offices, and on one day I stay open a little bit later. I also work one Saturday a month so that we can get more people in. But I feel like it's really appreciated, and I don't necessarily feel like I'm being overworked. I think that it's a really great pace, and I think that having the Friday half day is really awesome.
Get you an early start to the weekend.
Yes.
Dr. Soto, is it somewhat similar, or do you have a different experience?
So I like to sleep, so I don't wake up at 7 for opening up the office. I'm sorry, but
All
we
the
do.
old people want to come in at 7.
I know, but I'm sorry. I like to sleep. But we open up at 8, and then we close at 6 on Mondays through Wednesdays, and then on Thursdays we do a late day as well. But we've actually changed our hours since we have 2 doctors. We're doing access to care. So we kind of flipped a coin, and one doctor opens up on a Wednesday at 7, and then another doctor opens up on Thursday at 8. So we do 9 to 7 usually on Thursdays, but now it's from 8 till 7. And then Wednesdays we do 7 till 6 or 7 to 7, something like that. Yeah. It's still new. It just started this week. So yeah, we're trying to figure that out. But
Nice.
Friday we do the half day as well. And then Saturdays we flip the coin as well, depending on who wants to work. So we do 2 Saturdays sometimes a month.
So just to clarify, as you can tell, all of the offices, again, no cookie cutters, and it's up to the owners or the lead doctors that are in those offices to do what they think is going to be best for the community, right? But what I can tell you for a fact, and if you have any questions about this, I'm sure they can attest to it too, is that there is a great work-life balance. One thing that you won't be doing is you won't be working probably any more than like 41 hours a week. And that is so that you can essentially have a life outside of working. And I think that's a reason why a lot of dental students, you all, decided to go into the field of dentistry instead of working for medical doctors or any other things. Is a dental support organization is going to help you manage that work-life balance, what I think is beautiful as well. Okay, so I want to be respectful of everybody's time. We might go a little bit over. We have about 3 minutes left, but we'll probably push it to like 7 or so. I want to get all the questions answered. Does Aspen pay off your student debt in one go? I have heard about it. Yes, depending on the locations and the hard to fill locations. There are certain offices that are offering up to $200,000 in student loans. Again, the fact that they're offering these opportunities up to $200,000 means that they're having a hard time getting those offices filled with doctors. So that is dependent upon the owner of that office, and it's a simple negotiation tactic when it comes to talking about student loans. So, if that's something that you're really motivated and you're really motivated and willing to go to areas that are hard to fill, we can certainly help you with that. How many patients do they usually see daily? And Dr. Mehta, let's go ahead and we'll start off with you and just to clarify, you're in an AGD right now, right?
Yes, I am.
So how many patients are you seeing?
On a daily basis, with checking our hygienists and everything and doing exams, I want to say at least 12 to 16, if not more.
Okay. So 12 to 16. Now let's go into Aspen. And again, just to clarify, that is at Dr. Mehta's AGD, not at Aspen.
Yeah. And I only have one assistant. So I technically have
Okay.
one assistant, and then we just check our hygiene as needed. So
okay. Now let's get down to what we're doing inside those offices. Dr. Soto.
Okay.
You kind of mentioned it a little bit.
Yeah. So today the other doctor, he got called into jury duty. So I ended up doing double. But yeah, but it's okay. It was fine again. As long again, we have like 6 DAs. So one of them is assigned to me directly. And I mean, today I saw for production, saw like it was like 30-minute increments. So it was around like 10 or 12 patients for doing procedures. And then for like new patients and like overflow and things like that, that's something completely different. So again, add 26 to that, and then yeah, yeah, okay.
I'll do the math later. I think everybody's writing it down.
Then you have a sangria later. You're good.
Yeah. Just to clarify that before Dr. Despina says it, you know, and on top of that, you're not doing the presenting of, you know, the pricing and all of that different things. So if you can include that in, Dr. Despina, on top of how many people you see, as far as like the experience goes, please add that in to your answer as well.
So my office is, again, a single doctor office. I have 4 DAs, 1 hygienist. I see on average about 35 to 40 patients a day. And that's not just including production and new patients, but also what we would call overflow, as well as like obviously overseeing like hygiene. So the way that it works is you're in a production, you get called in to see a new patient or to oversee someone else. When you see the new patient, you come up with a treatment plan, and your office manager or the assistant office manager is there to do what's called a handoff, where they escort the patient back up to the front, and then they have a consultation regarding what their treatment plan is, and they can do further explanations on what we've recommended, along with a breakdown of what insurance is covering or financing or whatever the patient may need. So it should have a very seamless flow, so that the patient feels like they're being catered to.
Nice. So, you know, that sounds super overwhelming to me. I'm not a clinician. Those D1s, 2s, 3s, heck, even the 4s that are like that many people. Can you explain about how you got there, as far as like you didn't start off seeing 26 people day one. How did you slowly kind of ramp up to that amount, and how do they help you manage that many people? Dr. Soto, start it off.
Yeah. So I started off as an associate, and basically you have like that doctor that's there, and he's been there for a while, you know. I got very lucky. My doctor that I work with, he's a partner with the owner doctor. So he's been in the game very, very long. Okay. So he knows how to manage an office really well. Okay. Basically he did let me do procedures at my own time, and then kind of like oversee new patients, and then kind of slowly go into it. And then 2 months in, I ended up becoming a lead dentist, and yeah, that's how it worked out.
That's how you started seeing that many, huh?
Yeah.
But the support is there, right? Like you're not just like thrown into the fire, right?
No, not at all, because they saw me at 2 months that I was getting the hang of it, you know. So they had a choice between other associate doctors to like give them the opportunity to go. And believe me, they wanted to go, especially during that COVID time that many people got furloughed and everything. I ended up actually becoming the lead dentist because all the other associates ended up getting furloughed. So it really sucked. But at the same time, like, you know, I felt prepared enough to like run the whole practice myself, you know, because again, going from an 18 people office, seeing 26 new patients, going to a 5 people office, it was cake. We're good.
Anything to add to that, Dr. Despina?
Yeah, so I did want to mention that when I started working for Aspen, I actually did a 4-week onboarding session with my owner doctor. So basically what Aspen does is they don't just send you straight into an office and tell you like, go do it. They put you with someone and they kind of see what your skill level is, and then you go from there. So basically they start you off with production and then slowly integrate you into seeing new patients, as well as, like I said, the overflow procedures, until at the end of the 4 weeks, you're managing the clinic on your own. And so it doesn't happen overnight. It is like a seamless kind of process where they really try to integrate you instead of just throwing you in there. You're not like supposed to drown. You're supposed to really be successful.
It's like a 4-week mentorship in a way.
Yeah. So we like to call it a little mini DPR, but the doctor development program.
Yeah.
And I want to say, and if you all agree with me here, you're also getting paid to learn, right? So often than not,
yes.
that's a great incentive. You're getting paid to shadow, to understand what's going on. And on top of that, you're kind of going at your own pace until you feel absolutely comfortable. So, I want to definitely mention that there. I want to be very respectful of everybody's time. A couple things I heard. So, going on furlough, that's unfortunate, but those were the times at that time. We are now at 100% operation. We do have 850, and by the end of the year, probably in the next couple months, we'll be eclipsing 900 offices in 44 states. So that kind of shows you kind of the network and the support. And just like Dr. Despina and Dr. Soto have been doing for the past year, and Dr. Mehta in the future, they're going to, stay in contact. And this is kind of the peer-to-peer network that you have on top of the network of the owner doctors that you can reach out to, the official and unofficial mentors that work for the company as well, on top of anything and everything technology related and things of that sort. There was a question regarding the money side. I'm going to keep this short and sweet. First of all, no contracts. So you are not obligated to commit to a certain term, right? So at any point, if you don't feel like this is the best fit for you, obviously we're going to do our best to focus on that. Then you can technically work across the street at the competitors the next day. That's how confident we are in kind of on that particular end of it. There are daily guarantee rates, which means you're getting money and you're getting them a minimum amount no matter what. And that average is about somewhere around 150 with opportunity, and this is as an associate, $150,000 a year with opportunity to make upwards of like $200,000 in some offices based on profit sharing. Again, we're not going to talk about that today, but if you have any questions, I'll have all of our contact information. And we are essentially opening, 80 to 85 offices every single year. So now there's new opportunities that are popping up. Not just in California, like Dr. Mehta, we'll be opening, our end game is 80 offices in California over the next like 5 to 10 years. But we're on a consistent rate of trying to open 85 offices every single year for like the next 5 years. So, that's a good thing for all of you dental students that are joining us today. First of all, I want to thank everybody for coming on. What is the one final piece of advice that you guys would recommend to everybody listening? Let's start off with Dr. Despina.
Just be confident in yourself. I think that was like a hard lesson learned, but you just need to be like really proud of where you are and how far that you've come. And I think that you need to like really take that to heart. And when you get into an office, it doesn't matter if it's with Aspen or wherever you are, you have to know that like what you're offering to these patients is really like worthwhile, and you do make an impact on their lives. So just keep up the good work, be confident.
Very well said. Dr. Mehta.
Oh geez, I feel like Despina so beautifully. And I want to say like same, because that is one thing I've definitely learned. Just be confident. Some days some stuff might happen, and just go in there, be confident, and everything will be okay.
Well, that's very inspiring. Dr. Soto, final words from Dr. Soto.
Same exact thing. I wouldn't say be confident, but at the same time, always stay calm. There's always a solution to any type of problem. Yeah, that's basically it. Yeah.
You know, on top of that, I think one of the main things to also know is having an open mind and a willingness to learn. This particular type of atmosphere is going to make you a very successful person. If you're closed-minded and you're talking to another doctor that has been there and done that and knows everything, at least what they've experienced throughout that time, being able to listen and say, you know what, I'm going to challenge myself. You know, I'm going to try to make myself a better clinician day in and day out. That also will definitely help you as well. So we're going to go ahead and we'll leave it there. I want to first of all say thank you so much to all of our doctors, surprises and expected doctors that were in attendance today. Finally, again, free CE opportunities, check it out. I'll make sure to email everybody so that you have all this information on there. And finally, I will also throw this on the email as well, but you're welcome to reach out to us at any time. Keep in mind, our doctors are very busy. So if you have any questions, feel free to throw them my way first, and then we can also create like an open discussion with everybody. That's my cell phone number. Text me. It's probably the easiest way to get a hold of me. If you have any questions, I know, especially for you D4s, graduation's right around the corners. I want to be able to help you regarding any questions. And I'm also offering my services for resume building, any advice that you have, whether it's with Aspen Dental or it's with other locations or other DSOs or other private practices. But I just want to say thank you again to everybody. Thank you to Mike and Adia for helping me out put this on. Final words from all of our docs.
If you guys need anything, I mean, like, feel free to contact us, I would say, or me. Like, I don't mind. I am busy, but I feel like I can shoot an email out there. Or if you have any questions. So yeah.
Cool.
Yeah, same
right.
thing.
Same.
Happy St. Patrick's Day, everybody. Thank you. I miss you three, and I miss you.
Aw.
We will be seeing you soon, and have a great day.
All right, sounds good.
All right, take care.
Bye.
Stay safe, everyone.
Good night.
Bye.
All right.